Joining us now is also public health advocate and former PhilHealth head executive staff, Dr. Minguita Padilla. Welcome to Storycon, Doc. Thanks for joining us.
Good afternoon, Doctor.
Hi, nice to be back. Although different
Good
show.
afternoon, Doc.
Yes.
Hi, good afternoon to everybody.
Doc, the big news today is the PhilHealth president and CEO, Mr. Emmanuel Ledesma, has been replaced. We didn't see this coming. And the new guy is Dr. Edwin Mercado.
I saw it coming. I saw it.
Okay,
coming.
so tell us what you know.
But I'm not telling you how I know.
And what
I
do we
saw
know
it
of this?
And who is this Dr. Mercado, Minguita? Sino siya?
Okay, actually, we in the medical field we actually welcome the appointment of Dr. Ed Mercado as PhilHealth CEO, no, President and CEO. Ed is a UP graduate. He was a contemporary in the College of Medicine. Kilala namin siya. He's an orthopedic surgeon. But aside from that, he has 37 years, more than 30 years practicing. No, he's also not only a practicing physician, he's also a hospital administrator. He's also somebody who has public health knowledge, no? Who studied public health. He's also a researcher, and he's doing a lot of work also concerning primary health care, even AI in primary health care. And he's also doing work regarding funding for global health. So all of these things give him very good credentials to head PhilHealth. Kaya nung nalaman namin na siya, natutuwa ang marami. Most of us welcome it. But we all had the same comment. Almost all had the same comment. Ay, nako, salamat. No, we all help him. We wish him well. But sana, ito palaging sinasabi, sana hindi siya makain ng sindikato. That's always what people say. Ay, nako, let's wish him well. Kasi fraternity brad ko rin siya in UP, no, College of Medicine. And everybody is saying, ay, nako, let's wish Ed well. But let's also hope na hindi siya makain ng sindikato. And I have a lot of advice to give him if I have a chance to talk to him.
Pero, di ba,
Doctor,
Doc,
this is related to the controversy over the impounding, no, of the 89.9 billion PhilHealth quote-unquote unused savings or excess funds, whatever they want to call it. And I remember actually ang suggestion ng iba, kung ganyang hindi pala nagamit yan at talagang may savings, why don't you just fire the PhilHealth chief and replace him? Yun ba ang dahilan? Because the replacement here, yun ba talaga ang dahilan?
I think patong-patong na, Ami. It's not just that, no? And but we're also saying it's not enough that you replace the president. You have to clean up in the execo. President Duterte had 4 PhilHealth presidents. First was De La Serna, Dr. De La Serna. Then he had, I'm sorry, the gentleman, I forget his name now. Then he had General Morales, and then Giran. He had 4. Okay, and the pinakakawawa sa lahat, Roy Ferrer was the second, no? And then Morales, and then Giran. And Morales ended up what? Talagang, diba, he was charged, he got sick. Whereas the people responsible for leading him astray are still there. They're still there. And they have to clean up the execo. I'm really sorry. There has to be some accountability. And that's the difficult part. And it needs courage and political will, not just on the part of the new president, but also on the part of the appointing authority. Now they have to back him up. Because I believe that Ed is a good guy, and he's competent, and he wants to do what's good. And he doesn't need this job. I think he's doing it to serve. Like many of us, we don't need this. Sakit ng ulo yun, ba? Kaya lang, may pagkakataon siya. So sana, I hope they allow him to do his job properly and do not pressure him to politicize PhilHealth too much. It should be insulated in a way, but there are certain reforms that we would like him to do. Certain reforms we would like to see.
Doc,
and I can talk about that if you wish.
Doc, meron bang mga cases o reklamo na nakafile dito sa mga binabanggit yung mga enablers inside PhilHealth? Dahil kung wala
may
kasing...
kaso mo. It's documented in 2021 during the time of President Duterte. Because of the Senate investigation, napilitan ho si President Duterte formed a group to investigate all these complaints. And as a result of that investigation, charges were filed by the NBI against some many of the members of the EXECOM. Unfortunately, binalik ko sila sa lahat ng posisyon nila, original positions, without any internal investigation. No one was ever held accountable, even if from our thinking, the evidence from the Senate was really strong. That's why the NBI filed charges. But what happened to these charges? And why are they all back in the original positions, which are very sensitive? They involve money, they involve IT, they involve supplies. So yun ang mga tanong namin. So gusto namin, many of us want to advise and give the new PCAO a lot of the information, so he doesn't go in blind. No? He goes in with eyes wide open, and he understands the very, very complex problems he's going to have to solve inside PhilHealth.
Doc, why do you think it's so hard to clean up the agency? And secondly, what kind of reforms did you want to see? At least, let's say top three, apart from the 89.9 being returned.
It's very difficult to clean up the agency because the people who are, I don't want to say mafia, or they call them quote unquote the real mafia, are so entrenched, no? And they also have some political protection. Some politicians protect them. That's why we need to insulate them from that, no? And we need a president who will really back up a good PCAO. What reforms do we want? We want real digitalization. Because if you have true digitalization, it's more difficult not to have corruption. It's easier for hospitals and PhilHealth to have their records reconciled. You don't have PhilHealth saying, nabayaran na namin yung ospital. The hospital say, wala pa kami natatanggap. Hindi nagkakatugma, hindi nag-uusap ng mahusay. Plus, you will know kung may pumapasok talaga sa treasury or wala. Because sometimes people in cahoots, and there were, and I think there still are. No, we have to investigate that. Yung mga premiums ay hindi pumapasok sa treasury. If you have a good system, then it's more difficult to do that. No, and then it should not be porous. Kasi right now porous. We were able to fix it before I left, but I'm sure, I don't know if it's still the same. Okay, and I was told there's a lot of resistance to really good digitalization. So there should be digitalization and accountability. As I said, those who have been doing wrong, and if there's evidence, at least an internal investigation and hold them accountable. Wala pa ko no? And then maybe outsourcing of certain functions like finance, like collection and payment. It could be outsourced. We make it more efficient, no? And then make sure that the legal team is actually qualified. Because the PCAO in the past has been given legal advice which is a little off, and which actually got them into trouble. So marami ho. Then I have some advice also. The PCAO, choose the right advisors who don't have any vested interest. Because I've been there, I know that if you are clean, if you're competent and clean, and if you resist the temptation of falling into the pit, some people will try to destroy you by leading you astray, by tricking you into doing something that's not quite right. And government service is a little different from private, and there's so many possible, there's so many dangers along the way. So he should really get the good advisors and a good legal team as well.
Doctor, this year walang subsidy ang PhilHealth, ano? What are you saying in terms of impact on their services? Kasi apart from not giving them a subsidy, nag-pass ngayon ng House ng bill reducing the premiums. Ano kaya magiging impact on the services, on the universal healthcare law?
Yeah, it's really wrong because, well, I don't know about the reducing the premiums. Huwag lang nila sabihin na hindi na dapat magbayad. Somebody was actually saying that, no? We have seen since 2023 a systematic defunding of universal healthcare. Pababa ang binibigay nila sa health, sa PhilHealth specifically, at pataas naman yung medical assistance to indigent patients, no? And financially, yes, yung MAID. So, dumataas yung dole-outs at yung patronage politics, health. Bumababa naman yung universal healthcare, which is the exact opposite of what we're supposed to do. Every year, we're supposed to give more. And what they did in giving a zero budget is we are also going to petition again in the Supreme Court. There's an ongoing petition now, oral arguments about the 89.9 billion. We were part of that. We will petition again regarding the zero budget because, again, it is against the syntax law, it's against the UHC, because certain funds are already allocated, di ba? for PhilHealth. So, hindi mo lang magagawa yun just because ayaw mo. And kalokohan itong sinasabing maraming pera. Isa pa yun. Maybe our new president should really embark on some forensic accounting. Saan napunta yung pera? Because if you look at the financial statements of PhilHealth, the audited one for 2023, pinapakita nun, deficit ng mga 600 plus billion. And they have a 1.13 trillion insurance contract liabilities, meaning mga utang.
Trillion.
Not there. Yes, it's in the FS, audited financial statement. So in other words, there have been articles coming out in other respected newspapers, broadsheets, that what they were been saying all along was actually not true. They're using as basis a finances which does not take into account all of these liabilities, these deficits. And ang daming hindi malinaw. So kailangan linawin because as a clinician, as a surgeon, I'm sure Dr. Mercado will agree, you cannot solve a problem unless you first diagnose it and face it and admit there's a problem. Because all this time, when we were all shouting foul, we were all shouting, teka, maapektuhan yung benefits, no? Our immediate past president of PhilHealth was saying, no, kaya niya, no, kaya. They kept raising the benefits. But still, the hospitals are afraid because many of them, okay, you raise the benefits, so we have to deduct more. But you're not paying us. You see, there's so much bravado, but the hospitals are also suffering. So Dr. Mercado knows this firsthand because he's an administrator. So we are very, so he's in the trenches, ika nga, no? It's not just theoretical. He knows what it's like to be on the receiving end of PhilHealth policies. So we're hoping that he will be, he will do the right thing, but we also need to help him, and we're hoping that PhilHealth will be, in a way, insulated. If they're doing the right thing, they cannot be under the mercy of politicians, who threaten them. Unless you do this for me, unless you do that, mahihirapan kita, tatanggalan kita ng pondo, yung mga ganon. Dapat ma-insulate yung health. It should be above politics. Yeah. And we're hoping that the president will also say one day, lay off health.
On a different note, Doc Minguita, ano yung update nyo sa Supreme Court hearing on PhilHealth funds?
Actually, I could not go kasi galing ako sa Isabela, no? Okay. Wala pa akong narinig na feedback. I'm not sure if it's still ongoing.
Ongoing. It's ongoing.
Yeah. It's ongoing, so I cannot get any feedback until after the oral argument. Right. So mamaya natin malalaman.
But Doc,
i-update ko ang lahat even through my page. I always update. So
but Doc, coming back to your point about si Doc Mercado, he's going to be, it's not just within his own agency now. He's going to be up against other government agencies. Kasi for instance, the Finance Department itself said just yesterday that their accounting, their assessment of PhilHealth's excess reserves is not wrong. They said the revenue and expense recognition are faithful, may excess reserves talaga. That's why they ordered the transfer of 89.9 billion. So the point being, si Doc Mercado, the new PhilHealth CEO, is going to be up against other government agencies
like
as
DOH.
He tries to clean up, and DOH as well.
DOH.
Right? So
another
DOH
UP
is also
graduate.
maintaining that same line of the Department
Doc
of Finance, isn't it? Actually, actually, they sit on the PhilHealth board. It's very difficult. As I said, it's a very complicated and complex and difficult position he's in. Because some of the people who actually facilitated the transfer of PhilHealth funds and who did not complain when they were defunded and given a zero budget are part of the board. And yet, we cannot deny that we have a copy of the audited financial statements of PhilHealth, audited by COA, and it's clear that they're not wallowing in money. They have a 400 plus billion reserve fund, which is mandated by law. They have to have like 2 years reserve. Now they can invest that. But aside from that, they have a 630 plus billion deficit because of their insurance contract liabilities of 1.12 trillion. It's all in the FS. So how do they explain that? How will they explain that to the people now? No? So parang a lie said 1,000 times becomes the truth. No? But we have the evidence. We have the documents.
Yeah.
So, ang hirap i-reconcile.
to-
I-reconcile.
It's going to be a massive challenge for him, and we definitely wish
Yes.
him well. We're going to have to leave that there for now. Thank you so much for joining Storycon Public Health Advocate Dr. Minguita Padilla.
Thank
Thank
you,
you very
Doctor.
much.
Thank you, Doc.
Thank
Good luck
you,
sa
Doc.
kampanya.
Ay, salamat.
Good luck sa, well, yung oral arguments
She's
are
running for a party list position. She's running.
Yes. BHW.
Barangay Health Workers.
No, Barangay Health and Wellness. But
Yeah.
we're
Health
representing the Barangay Health
BH.
Workers, among others.
Oo.
And we will have the Magna Carta. The Magna Carta will become law soon. Salamat naman.
BHW, Barangay
Yes.
Health and Wellness.
Health and Wellness. Okay.
Thank you, Doc.
Thank you.
Thank you. Bye-bye.